Hi everyone, my name is Shauna in case you don't know, and welcome back to another video. This is probably going to be quite a long video and it is going to be possibly triggering for some people, so just be careful. The triggers that I can think of off the top of my head are needles and hospitals and medical testing, if that's a trigger, and suicidal thoughts and depression and anxiety. So the reason why I look like this today, first of all, I'm cold, so I'm wearing this sweater. I don't often wear it in videos just because, I don't know, sweaters aren't the most comfortable thing in the world to me. My hair is a mess because I can't take showers by myself right now. I sort of have to have someone sitting there making sure that I don't pass out, and oftentimes I need help with my hair because, as you're about to find out, my arms are really weak. I have a lot of acne on my face right now and I don't have makeup here, and since my arms are weak, I don't think I could even put on makeup right now. So my acne just is what it is. And also, I haven't been able to eat solid food, as you're about to learn, and because of that, my tongue has a little bit of white gunk on it. And I've been trying to brush it off. It doesn't really brush off. It's not thrush. I already had thrush and I will tell you about that later in the video. It's just dead cells on my tongue, and that's because solid food scrapes off the plaque and the dead skin cells. So when you're on a liquid only diet, then the dead cells don't come off on your tongue and you get a bunch of plaque on your teeth. So let's just crack on into this video. I spent 12 days in the hospital and my symptoms were nausea and more nausea. The nausea is in my throat and my stomach. I don't think it's very common to have nausea in my throat because whenever I tell a doctor I'm having nausea in my throat, they look at me as if I'm some sort of weirdo. Oh, I shouldn't lean back because then the lighting gets a little messed up. But anyways, so I went to the emergency department 3 to 4 times at this one hospital near my house. And on the 4th or 5th time, they finally said, we need to admit you. So I was like, okay, yeah, I need this. I need them to run tests. I need help. So I spent 12 days at that hospital and it was an absolute waste of time. They ran some tests, but they didn't tell me that I had gastritis. And it actually took going to another hospital to get told that I had gastritis from the endoscopy that they did at that first hospital, which I think they should be sued for, but I don't know if I'm gonna do that. I'm at least gonna file a complaint against the doctor that I was seeing most of the time, because he was a doctor that was letting the title of doctor get to his head, and he became rude and insensitive and mean, and a lot of times after I saw him I would just feel defeated and depressed. At that hospital I got over my needle phobia though, so I can handle needles now. I had multiple IVs there because my IVs kept going bad, and my IVs kept going bad at the second hospital too. I think I only had my IV replaced once at the 3rd hospital that I was at. Yes, I went to 3 hospitals. It was a big issue. So after I was discharged, because they basically said they couldn't help me because they tried to give me a feeding tube because I hadn't eaten in 2 weeks or so. They tried to give me a feeding tube, but the first doctor that I saw, because the doctors change every few days in the hospital, the first doctor that I saw was going to give me the infant feeding tube, which is the one that I wanted, because the infant feeding tube is the one that is really tiny, and that's the one that I wanted because that's the one that I thought would hurt the least. But this mean doctor completely ignored the other doctor's notes, completely ignored my requests, and he tried to give me a big thick feeding tube, and they tried to insert it when I was awake. It hurt so badly. They stuck it up my nose because that's where the feeding tube goes, and it was pressing against my sinuses, and it hurt so badly and they just couldn't get it. Oh, I should have put a trigger warning for feeding tubes. Oh well. And then he put me under anesthesia, so I was put under anesthesia twice in that hospital, which I actually liked anesthesia because, I don't know, I felt a little better after I got off anesthesia. I just changed the lighting, sorry about that. But directly after I got off of anesthesia, I felt a tiny bit better. But he basically put me under anesthesia and gave me this super thick feeding tube, and it was so thick and stiff that it curved in my throat and it curved in my nose, and so it felt like there was a giant tiger claw in my throat and my nose, and it was the worst pain I'd ever felt in my life, and it made me suicidal, and so I forced them to take it out. I also got thrush at this first hospital. I wasn't brushing my teeth very well, and bad hygiene can sometimes cause thrush, but I also have a little bit of a compromised immune system right now because of what's going on. They started me on some anti-nausea meds while I was in the hospital, like through the IV, and I find that the IV versions work a lot quicker and work a lot better, but as you're about to find out, I had some side effects to some anti-nausea medications, and I'm going to talk about the anti-nausea medications right now because I feel like everyone with a chronic illness like me, because I have POTS and I have this other condition that I'm about to tell you about, I think all of us just think of the first one that they give us, which I'm drawing a blank on what it's called right now. I want to say Zoloft, but I feel like that's an anti-anxiety med. But the first one that they give you does not work for me. In fact, it made my nausea worse. So when you go to the hospital or the emergency department, if you know that the first one doesn't work for you, tell them that, because there's some other ones that you can try. So the one that starts with an R that I'm drawing a blank on the name, that one, the side effect was that it made me more anxious and it made me really shaky. So that one didn't work for me. Phenergan didn't work for me at all. It's in the same class as the first one that they always give people. And I've been prescribed the first one a lot, and I think everyone with nausea might know which one I'm talking about. It's the one that dissolves under your tongue, or they can do it through IV. So Phenergan didn't work for me because I think it was in the same class as that first one. So basically that whole class that first one and Phenergan is in, that whole class does not do anything for me. So after that I got Haldol. Well, you'll find out later that Haldol I had bad reactions to. Also, let me just drink from my cup because I'm dehydrated. I had the really bad side effects to it. So Haldol I was given for a day at that first hospital, and it worked really, really well. But all the other nurses were like, we can't give it to you because it has bad side effects. So I was like, this sucks. You give me a day of relief and then you just strip it away from me. And they were giving me a pretty high dose of Haldol. So that sort of sucked. Then there's 2 more anti-nausea medications. Compazine, which Compazine worked for me for a while, but then I almost like got tolerance to it and it stopped working. And then the final one, which I was prescribed at the second hospital, and then my prescription was canceled at the third hospital, was Perfenazine. Perfenazine is the one that worked well in an outpatient setting. Perfenazine really helped with my nausea. It brought it down from a 12 out of 10 to a 7 out of 10. But basically when my nausea was at a 12 out of 10, imagine that you had the stomach flu or food poisoning and you knew you were gonna puke. That's what it felt like, but I never puked. Also, so I'm going to be talking about the second hospital now, and I just want to warn you, there is a trigger warning for vomiting too. I should have thought this through a little more and done all of these trigger warnings in the beginning instead of bringing them up later, but oh well. Also, I was in the CDU, I think is what it's called, at the first hospital for like a really long time before I was moved up to the 9th floor, and I think it's called the CDU. I shouldn't have been there that long. I should have only been there like 2 days, but oh well. It is what it is, and I liked it on the 2nd floor better than the 9th floor because I'm scared of heights. But anyways, let's move on to the second hospital because I don't want this video to be like 3 hours long. So the second hospital was a more academic type of hospital. I don't know if you can tell, but I'm stiff a little bit in my back and shoulders, so I'm like hunching over a lot. But you'll find out why I'm stiff in just one sec. So the second hospital was my second favorite, but I didn't really like it that much. So I went to the emergency department, and first of all it took forever to get my IV, and I was like, I need Compazine, because at the time I didn't have Perfenazine, and I was like, I need Compazine, and so I was just in the room for hours before they even gave me an IV, and my nausea was like at a 12 out of 10, and I begged my parents to take me to this hospital because I was so nauseous, and we got recommended to go to this academic hospital because they thought that they would be better. So I was in the emergency department and I could see that there was a little like security camera thing up there, and so I was going Like, that was my way of trying to say, like, give me the IV right now, because I knew that I needed help. Eventually they gave it to me, but it took until about 3 or 4 in the morning before I was finally admitted into the hospital, so that was really frustrating. And what was even more frustrating was that I was admitted into I think it was called a refeeding program, which is mostly for people with eating disorders. And I don't have an eating disorder. I was misdiagnosed with an eating disorder. I really disagree with the diagnosis of an eating disorder, because the reason why I struggle to eat sometimes and why I'm on a liquid diet right now is because of my nausea. And I feel like labeling me as having an eating disorder, people just look at the eating disorder and they ignore the nausea, when the nausea is what we need to be working on the most right now. So that is really frustrating to me whenever they say that I have an eating disorder. And there was one doctor that was saying that I had an eating disorder a little bit at that hospital, and it was really frustrating. So my IV was like going bad like every day at that hospital until they took it out. So since I was in the refeeding program, they had 2 meals where they tried to force me to drink Boost, and I think there was like one other one that they tried to force me to drink. Here's the thing, when I feel like I'm about to puke, I'm not going to be trying to feed myself, so I only got through about like half of each cup. So they did like a breakfast and a lunch, and I just could not do it. So they're like, we need to give you a feeding tube. And at that point I was like, I haven't eaten in a while, and I was like, maybe it won't be as bad as I think it's going to be, because they tried to give me a feeding tube in 2018 when I was originally misdiagnosed with an eating disorder, and I just refused it. And I was like, maybe it won't be as bad as I think it's going to be. So they put in the feeding tube, and I puked. I have a really strong gag reflex, so like putting things up my nose and down my throat caused me to puke. And I have a massive fear of puking, so that really sucked for me and took a toll on my mental health. The feeding tubes made me suicidal like it did at the other hospital, and they made my nausea worse. The only nice thing about the feeding tube was that I didn't have to worry about swallowing pills, because they just like put it down the tube. But I had an infant tube at this hospital, so it had the risk of getting stuck. Now I had that one in for 5 days. I was meeting with doctors. My nausea, at first they were like looking into it, and then they just sort of like shoved it under a rug and just ignored it, which is a big issue for me, because my nausea is the issue and the reason why I was checked into that hospital. And so to sort of ignore that and to focus only on the refeeding part was really frustrating and invalidating for me. It made me feel like my nausea wasn't that big of an issue. Oh, and I forgot to say, at the first hospital, the bad doctor blamed all of my nausea on my anxiety. So that really sucked. And also, before I give you more information about why I got the feeding tube out, I just wanted to say that I also went to Zoom Care, one of the super clinics. Zoom Care just gave me that first nausea medication, and they were no help at all. Don't go to Zoom Care if you're having nausea that the ER couldn't help you with, because Zoom Care won't be able to help you. And if you need an IV, you need to go to a Zoom Care super clinic, or else you won't be able to get an IV at the Zoom Care. I also had to call 911 at one point because food was also getting stuck in my throat. So currently I have a fear of food, and a fear of swallowing, and a fear of puking, which are 3 things that are not good because you need food to survive. Also, I'm sorry if you hear the lawnmowers. At the time that I'm filming this, we currently have a ton of smoke outside, and there's a slight orangey tint to the sky. I live in Oregon, and we are having some of the largest fires that we've ever had. So it frustrates me that there's people in my neighborhood who are hiring other people to come and go in the really unhealthy air quality with the smoke to mow their lawns. It's just ridiculous to me. But anyways, that was a side tangent. So let's get back to the feeding tube. So the reason why I got the first feeding tube out was because I puked. They were slowly increasing the amount of food that they were giving me through the feeding tube, but when they did it to the really big amounts, my stomach couldn't handle it and I puked. And it was like everywhere, and as soon as I puked, the baby feeding tube slipped out of my mouth. And so I yanked that feeding tube out of my nose, because I was like, there's no way that they can stick it back in my throat, because it's just hanging out of my mouth and I'm keeping puking. And I puked a lot that time. So then they were like, we need to give you another feeding tube, and I was like, great. And when I puked, my dad was in the hospital room, so I was like, Mom, you need to be in the hospital room when they do this, because my brain was connecting puking to my dad. So I had my mom in the room, and they did a feeding tube that had a little weight at the bottom so that if I puked again, hopefully it wouldn't slide out. They put in the feeding tube. It was as unfun as the last time, but I was fine. And then they did the x-ray of my stomach to make sure that the feeding tube was in the right spot, and it wasn't. And my mom was leaving to be replaced by my dad. So I was like scared, and I had had a little bit of juice the night before, so I did have something in my stomach. And when they readjusted the feeding tube while my dad was there, I puked. Now I puked and I felt the feeding tube get displaced, and they didn't do another x-ray to make sure that it was in the right spot. So yeah, I felt like it got displaced and it felt wrong in my throat, and it was still making me more nauseous. It was still making me suicidal. They didn't let me leave my room for a little bit because I was so suicidal. But that one came out after 2 or 3 days. The reason why is because, as I said, the infant feeding tubes have the risk of getting clogged if they're shoving pills down there, and mine got clogged. So it was a dysfunctional feeding tube after just 2 or 3 days with it in. So they're like, we need to go bigger in size, and I said, nope, you are not putting another feeding tube in me. And then I puked again, so a nurse came in and took out that feeding tube, and I was like, I'm never having a feeding tube again. And I was very explicit with them that I'm either going to drink the protein drinks or I'm going to starve to death. And I was mentally prepared to starve to death if I couldn't handle the protein drinks, because I will never have another feeding tube in my life. So I basically forced them to discharge me. If I had another feeding tube, I was demanding anesthesia because I couldn't handle the puking again, and they were like, no can do. So I left that hospital, and they gave me these drinks to drink. I should go grab one, but I was lightheaded when I stood up earlier, so I'm not gonna go grab one. But they're these like 4-ounce Ensure compacts that have a good amount of protein in them. I'm supposed to aim for 12, but I'm hitting 8 a day, and I'm maintaining my weight, so I think that's good for me. At first I was just doing 6, which wasn't good, but I was slowly able to increase it. So I was home for about 2 or 3 days, and then I went to my 3rd hospital. Now the reasoning why I went to my 3rd hospital is a little different. So while I was in that 2nd hospital, they were giving me Haldol to help manage my anxiety, and they started me on this medication that actually helped with my nausea and brought my nausea down to a 7, which is the profenazine. But I was having a bad reaction, so I was really stiff. So let me stand up and show you how stiff I was. So I scared one of my family members with this, but I was basically stuck like this. So I'd walk around like this, and I could barely move. I mean, I was terrified. I could barely function. One of the doctors at the 3rd hospital said I looked like someone who was an elderly patient with Parkinson's. It was that bad. I was also shaking whenever I laid down, and I couldn't stop the shaking. And the shaking was because at the 2nd hospital they gave me this drug called Ativan, which is a common one that's used to help both anxiety and nausea, but it didn't do anything for me. If my nausea was caused by my anxiety, it probably would have worked. So they gave me this drug, and they increased my dose right before I left, and then they said, we don't prescribe Ativan to people who are outpatients leaving the hospital. So basically I didn't receive any Ativan for me to take at home, and I was having withdrawal to it. And I was also having the bad reaction to the Haldol and the profenazine, even though I wasn't given Haldol to take it home, I don't think. But my stiffness started in the hospital when they were giving me Haldol, so they stopped Haldol while I was in the hospital because I was having a bad reaction to it. But they let me go home with this stiffness. I went home and I could barely sleep because I couldn't get comfortable with my stiffness. I basically had to lay on only this side, which caused this arm to hurt and fall asleep a lot. I couldn't roll over to the other side because it was so stiff, and I couldn't get comfortable on laying on this side, and I couldn't get comfortable laying on my back. I was just this stiff creature, and I could barely function, and my nausea was at a 7 out of 10. So the stiffness is what brought me in. I begged and begged and begged my parents to take me to the hospital. And at first they were like, no, we are not going back to another hospital, because I spent 12 days at the 2nd hospital as well. or 14 days, I'm not sure. But eventually I convinced them to take me to an urgent care, but unfortunately the urgent care had changed to just doing COVID testing, so she told me to go to this mental health hospital, which was a really scary experience for me. I don't want to make anyone scared about getting a feeding tube or about going to a mental hospital, but in a mental hospital you get separated from your family and you don't get to see them, really. There's sometimes some people who are yelling a lot in there, and there's someone who was yelling while I was there and it was stressing me out. The reason why the lady told me to go to the mental health hospital is because we thought I was having an Ativan withdrawal, and Ativan is a psychiatric drug or a psychotic drug, and so they were like, a mental hospital should be able to help you. But at that time I also knew I was dehydrated, so I was like advocating for an IV, and the mental hospital was like, we can't give you an IV. So they basically just put me in this room when the screaming lady came in, and I was on a mattress on the floor, but I couldn't get comfortable because I was stiff. They gave me a shot of Ativan to help with my withdrawal, so my shaking got a little better. And then they called an ambulance for me and took me to a different hospital that I hadn't been to yet. This third hospital was the best hospital that I was at, but it was also rough. There was some parts I didn't like about it. So I had a lot more tests run at this third hospital. I think I had a barium test, and I had an MRI to see if there's anything wrong with my brain stems that could be causing the nausea. And the GI doctor wanted to do a gastric emptying study and a swallow study. But here's the thing, I can't eat solid food right now, and I have to go to therapy to work on eating solid food. So I was like, there's no way I can do that. And I knew that it was also an egg sandwich, because the GI doctor told me that it was an egg sandwich that I had to eat for the gastric emptying study. And I was like, there's no way I can eat egg. You can't force me to eat egg, and I'm also allergic to wheat. So I was like, what are they even going to give me food-wise that I can eat? Because it didn't seem like the hospitals were equipped for gluten-free. I don't know why I just got that sense even though I didn't order any food. And the GI doctor at the third hospital also let the title of doctor get to their head a little bit, so they were also really not that nice, and I don't know, it was just really frustrating. But eventually a good psychiatrist got called in. This psychiatrist was a lifesaver for me. This psychiatrist was able to tell me that he thought he knew what I had, and he told me where to get treated for this. And I currently have an appointment scheduled for a virtual appointment with one of the places to help this. Although the only doctors who treat this condition are in Michigan and Los Angeles, and I probably should get an official diagnosis, so I'm most likely gonna be flying down to LA at some point to get an official diagnosis from one of the doctors down there, because I think there's 2 places in LA that treat this condition. But this condition is basically a condition where there's a disconnect between your mind and your body, and most people experience pain, like a weird unexplained pain that can't be explained by testing. But for me, my pain is my nausea. That's just the way that it's presenting in myself. Now this condition, I'm not really sure what to call it, so I just call it a condition right now. Technically it's called a stress illness, I think, or a psychological physiological condition, or mind-body medicine. I think those are the 3 names that I'm aware of. Now if I hadn't gone to this third hospital, I still would have been clueless about my nausea, and I probably would have had to go to another hospital at a later point. They were able to identify which drugs were most likely causing the stiffness, so they took me off of perfenazine, and then I was already off of Haldol. And then they put me back on Ativan, but they slowly weaned me off of Ativan. Also, my voice changed. I haven't done this much talking in a while because I've mainly just been laying on a hospital bed watching the Food Network, even though that seems weird because I have a fear of food, but the Food Network has been really calming to me. And I was also watching like Impractical Jokers and Charmed and the Miraculous Ladybug Show, which I forget what the exact title is. But anyways, I got told that I most likely have this condition. I got referred to places. I got told some books that I could read about the condition, and my parents were reading the books and they were reading me excerpts, and this really sounds like the condition that I have. So I have an appointment scheduled with a person that will be able to help me. It will be hard, but I have hope that I can get my nausea down to a 5, because a 5 is what I'm at on a baseline level. Because of POTS, I have nausea of a 5 constantly, but it increased drastically in the past couple of months. because of this condition. At this third hospital, I have some stories to tell about it. So first of all, I think I only had 2 or 3 IVs, but one of my IVs is really weird. The reason why it had to be replaced is because it was leaking. So whenever they like squirt anything in, it was like leaking everywhere and my blood was getting all over it, and I was like, this doesn't seem right. So I made some nurses come in and help me with it, and I ended up getting it replaced. But the one that they replaced it with, they didn't really give me fluids in it very long, because the doctor was like, yeah, we're not going to give you fluids anymore because when you leave you're gonna have to drink normal water, which I think was a really bad thing to do, and I still think it's a bad thing to do. I still feel like I should be in the hospital just getting rehydrated, but they discharged me because there's nothing else they could do for me. So it's a new day and there's more smoke in the sky, which means a little different lighting, so hopefully that doesn't bug you too much. Also, I feel like I'm talking differently than yesterday. I don't know. My throat is hurting because I swallowed a pill wrong. So anyways, back to that third hospital that I was talking about. I just changed the lighting again. I'm really picky about the lighting, but I like constantly change it while I'm in the middle of filming, and I need to get out of that habit, and I need to just choose this lighting from the start because this is my favorite lighting. I like can adjust it on my camera, you know? Well, my phone. I don't have a camera because I'm not rich. Anyways, what I was saying when the video cut off, because there was an emergency in my household, but what I was saying when the video cut off was that there were 2 old people in my unit, and I felt like I was the youngest one there, and the 2 old people were screaming, and it was increasing my stress, which was increasing my nausea, which wasn't fun. Basically, with old people, sometimes when they go to the hospital, they get really confused and disorientated and they yell. And there was someone in the room right next to me that was yelling, and there was someone down the hallway that was yelling, and it was just a mess. This third hospital really helped me with my stiffness. They were able to identify what was causing my stiffness and take me off of those medications. And then I had PT and OT. OT stands for occupational therapy and PT obviously stands for physical therapy. I passed occupational therapy while I was there because in order to pass you have to be able to write something, and I wrote something in a journal, and then she was like, your handwriting looks fine, so we're done. But when I started off at that hospital, I couldn't do anything by myself because of stiffness. I couldn't even wipe after I used the restroom, so I had to get help with that, which was really embarrassing. I had to get help with showers. Embarrassing. And I say embarrassing just because I'm not comfortable with my body, but I know that it's not as bad for some other people, and some people just have to deal with that, especially when they're older. There were some exercises that I had to do in physical therapy. I'm not going to show you them here because I had low blood pressure this morning and I couldn't take my heart rate medication, so my heart rate is like freaking out right now, but I had too low of a blood pressure to take my heart medicine. Let's think, what other eventful things happened in the hospital? Oh, I had my first blood sugar test. That was really painful. How do people do that often? She's like, which finger do you want to do? And since I'd never had a blood sugar test before, I was like, this finger, because this is my right hand, so I was like, they can do this finger. And the reason why I was getting a blood sugar test is because I had low blood pressure, and even after my low blood pressure went away, I was still extremely lightheaded, so they just wanted to check my blood sugar, but I was fine on my blood sugar. But I was like, do this finger because it's on my left hand. And then they were like, normally people do one of these fingers since they don't use them as much. And I was like, okay, do whatever you want to do. And I think they did this finger, and it hurt so badly. In case you don't know what a blood sugar test is, they basically prick your finger with a needle and they did it to the side. And then they have the blood come out, and there's like blood like just resting on your finger, and when she wiped it, she didn't wipe it all off, so I had to like wipe some of it off myself. But then they take this machine, and then your blood goes up this little tester strip, and then that's how they check for your blood sugar. And I was normal, as I said, but it hurt really badly, and as soon as it happened, my finger was throbbing. It hurt worse than an IV or a blood draw. I'd rather have an IV or a blood draw. Although, let me show you something. I have bruises and scars from all the blood draws and IVs that they did because my body isn't healing right now for some reason. It's really annoying. Oh, and I didn't even say what I was doing in PT. I said I wasn't going to do my exercises, but let me go a little more into that. So for my PT, they were basically retraining me how to do normal things, especially walking, because occupational therapy focuses on your everyday tasks that you do that isn't exercise. So things like brushing your teeth and I don't know what else. They're basically just retraining you how to do your fine motor skills type things. So that was sort of helpful, but I also felt like I knew how to do those things. And then PT was focused mostly on my walking and some exercises to help my stiff back and arms. And walking, I was just walking really stiff like I showed you earlier, and they were just helping me with that. And I also did some stair exercises because I have stairs in my house and I live on the second floor in my apartment, so they were just helping me with that. Oh, the only other two things that I want to bring up about that third hospital is that they had the AC on and I could hear it, and I have misophonia, so pain with noises. I made a whole video on that and I'll link it down in the description below. But basically, the AC was on all the time, so it was hurting my ears. So I had the TV on constantly as white noise, and I would leave it on as I was sleeping to try and block out noises. Also, one of the shows that I watched was Impractical Jokers, and I have a love-hate relationship with that show because sometimes it's really inappropriate, but sometimes it's really funny. But there's some racist things in there, and I'm not going to repeat those racist things, but it's like, I hope that Impractical Jokers is going to change their, I don't know, show and get rid of that racism a little bit in light of the Black Lives Matter movement. But I don't know what they think of the movement, but I hope that they change the show a little bit because sometimes they were racist and I was like, this isn't acceptable. The final thing I want to bring up about that hospital is that since it's really smoky and the fire started when I was in that hospital, there was smoke coming in through the windows, so I could smell smoke really badly in my hospital room. Also, when I was there, I got informed that one of the hospitals that was in the like group that I was staying at, because there's like Providence, Legacy, Kaiser, like those type of ones, and the one that I was staying at, they had a hospital that had to evacuate because of the fires because they were too close. And I'm sure that was really stressful because I'm not even sure how you'd evacuate a hospital. I don't know, because there's so many people staying at a hospital because it's probably like multiple stories, you know? And there's two other things I want to talk about before I wrap up this video, which is there was a lot of like codes happening at that third hospital, and that stressed me out a little bit. There was a lot of code reds, which I think means violent? I don't know, because code green also could mean someone's violent or threatening and they have a gun, and there's a lot of code greens too. I don't really know how the codes work, and there was also a lot of code blues, and I think someone might have died while I was there because there was a "we need anesthesia right now" over the loudspeakers, and then there was a code blue, and I'm not sure if they made it or not, but I don't want to ask because I don't like to be saddened by death. The final thing I wanted to say is that since it is a new day, I actually just finished an Ensure before filming this video, so I wanted to show you one of the Ensures. This is an Ensure compact, as I said. The Ensure compacts have 9 grams protein. I'm currently doing 8 a day, but I need to get up to 12 and I'll be increasing to 9 soon, but I'm starting a new medication today, so I don't know when I'll increase. But they look like this. I get them shipped from a medical company to my house because if you go to the store, they're like bigger bottles and they're really overwhelming to me. The Ensure compacts are a little thicker, but you can chug them. My parents have referred to me as chugging them like someone in college would chug a shot, but like I hate them, so I just want to get them done. They smell really gross. They don't taste super awful. I prefer the chocolate to the vanilla, although I preferred the vanilla at first. But yeah, that's practically all about my hospital stays. I have several appointments scheduled to get further help with this issue because my nausea is not gone. In fact, it's really bad right now. If my eyes are watering, it's because I yawned, so don't worry, I'm not about to cry. But the appointments I have scheduled are PT with an outpatient setting, and my normal doctor and GI doctor and the place that can help me with my nausea, and then I need to schedule a dermatology appointment, which I'll schedule way in the future because my acne isn't of the biggest concern right now because I'm not feeling well. So yeah, I really hoped that this video just gave you an update on my life and that it was a little informative about my hospital stays. Hopefully I didn't deter you from going to the hospital with the first 2 hospital stories, and hopefully I didn't deter you from getting a feeding tube if you really need it. I think there are some cases where you need a feeding tube, and I think at first I needed a feeding tube, but I think if they would have just given me the Ensure compacts to start off with, I think I could have been fine. I think I am gonna go play video games because the psychologist at the third hospital told me to play video games 2 hours a day to practice mindfulness because I suck at mindfulness and meditation, and he was like, you can just play video games. And basically I just need to focus on the video games fully, so I might go do that, or I might watch more of the Ladybug show that I don't know the full name. If you want to, you can like this video and subscribe. You don't have to, but you can if you want to. I'll have all of my other social media linked down in the description below. So my life is sort of crappy right now, and I'm hoping that I'll get better. I lost a little bit of weight, which you can probably see in my face, because my face was a little more filled out in my previous videos. I think I'm at a good weight though, so I don't think I need to gain weight. But anyways, I'll see all of you later. I hope you're staying safe if you're in areas where there's fire. I hope that everyone is staying safe and healthy and not catching COVID. And I will see all of you in my next video. Bye!